Hello, friends. It's Carla, your online doctor, with today's Live in 5. Today is Tuesday, October 13th at 5 p.m. Sorry about yesterday. Again, it was another day on the phone with insurance companies. Okay, so obviously by now everybody knows President Trump has had COVID-19, still has it, whatever it is. But he received Regeneron's COVID-19 antibody cocktail, again, over about a week ago, despite it still being in clinical trials, but showing great promise. Now, the first 275 patients in the study had lab-confirmed COVID-19, but were not requiring hospitalization. Patients either received the high dose, which is 8 grams, or the low dose, which was 2.4 grams, in a single infusion alongside whatever the standard of care was at that time. Or they received placebo with the standard of care. So they were receiving an infusion of some sort, which could have just been saline, and those were the placebo group. So either placebo, low dose, high dose, and everybody got the standard of care. Now, the large majority of the patients were either Hispanic or African American. That's almost 70%. The patients were tested prior to treatment for antibodies to COVID-19. 45% of them had antibodies, but 41% did not have enough antibodies, if any, to actually log a reading. Yet this group did better, and also those receiving the higher dose, the 8 grams, did better than the others. By that, they showed the greatest reduction in the viral load when tested 7 days after treatment. But symptoms reduced along with viral load, which makes sense, of course. Those receiving placebo took a median of 13 days to recover from symptoms, where those receiving treatment took 6 to 8 days. That's pretty significant. I mean, we're talking 1 week versus 2 weeks. Now, the benefit of the antibody cocktail was to act as a substitute for the naturally occurring immune response, especially in those that had not created antibodies yet. Okay, so if they're still in that acute phase of the infection and the body is still fighting the virus and not have a chance to create any antibodies, those were the people that had the best response. Now, interestingly, they report no deaths from the treatment, but 4 patients had what they called infusion reactions and 2 others suffered severe side effects. Details or specifics of that was not provided in the article I read as of yet. But only 6 out of 275 had any type of reaction. Everybody else did fine. Now, Regeneron is hoping to confirm these findings in a second group of patients who have already been enrolled in the next phase of studies. They're also testing it in hospitalized patients as well as preventative treatment in people who have been exposed to COVID-19 patients, which could prove to be something very beneficial, clearly in somebody who is high risk. Clearly, if you've just been exposed, I don't think this is going to be an inexpensive treatment. So if you've been exposed and you're just the average person, this is probably not something that you will require. But if you're, again, if you're in a high risk group or you're somebody very important, they're looking at it for preventative measures as opposed to waiting until somebody has developed the infection. Now, Regeneron's treatment is a combination of 2 antibodies that target different areas of the receptor binding domain on the virus's spike protein. In layman's terms, basically 2 different antibodies that attack the virus at the point in which it binds to and gains access to cells, okay, in our bodies. The hope is using 2 antibodies instead of just 1 that target different areas. They can reduce the risk that a mutant drug-resistant form of the virus will escape treatment and become a dominant strain. Okay, so if you only are focusing on 1 antibody, at some point that virus can become resistant. It can mutate and change and no longer be responsive to that treatment. So if you have 2 antibodies, it's less likely. Clearly, the more antibodies that you create, the more likely that the virus will not be able to escape. the treatment. Okay, so maybe 2 isn't even enough. Maybe they should be doing 3, but again, they're starting with 2. The company is hoping for emergency use authorization, and since the FDA has shown a willingness to fast track promising therapies, it may be in the works already. Now, the thing that Regeneron, the company that makes Regeneron, is going to have to continue to do is modify the drug of sorts, because the virus will mutate and will potentially be able to escape one of the 2 antibodies, and then again it becomes less effective. So you always need 2 active antibodies of sorts to make the drug more effective. So this may be a drug that is constantly being updated and changed, or maybe become variations that they can have, Regeneron 1, Regeneron 2, 3, 4, because depending on maybe different areas of the country, or all different variables are going to come into play, that may require you to get a different combination of antibodies. Again, I'm thinking out loud, I'm speculating as to what may happen. I'm sure the company is way ahead of me, but if not, hey, I thought of it first, I'd like some money. I'm just kidding. But most importantly is that it is showing promise as a potential, a really good potential treatment, along with all the other standards of care, whether it be zinc, vitamin D, all the things we talk about, vitamin C, remdesivir, dexamethasone, the steroids, et cetera, et cetera. So we're hopefully getting a better grasp on how to treat this virus as the days and months go on. I did watch it was a 60 Minutes episode, and the question was asked, there was a couple of questions asked, but the question was asked, will we ever get to a point like the flu where somebody could go to the doctor's office and actually get a prescription for treatment, take it, and be fine, or improve within a matter of days, day or 2? And the scientists said probably within a year or 2, which of course, as we look at a year or 2, we all go, oh my God, that's like a gazillion years away. But each day and each week that passes, the scientists are finding more and more information and getting a better grasp on this virus. So be patient. And one other question that was answered or was asked in the 60-minute episode, you may want to watch it. A lot of this, there was about 15 scientists all asked if they had to choose between a vaccine and a mask, which would they choose? And they all said a mask. So I will leave that for you to ponder. On that note, I hope you guys are having an awesome day, and I will see you again tomorrow for another Live in 5.